Thank you for joining us today. So we have Carolyn Pardo with us today. Um, Carolyn and I met about 11 years ago when I first started off in CME, and since then and throughout her career, she's had a lot of success within the healthcare education space. So thank you so much for joining us, Carolyn. And maybe to start off, I'd love to hear how your experience has shaped how you think about measuring success in healthcare education. So, for example, what challenges have you seen with traditional methods, and how are things shifting now with all of these new technologies coming into play?
Right. Well, first, let me just thank you for being able to have this conversation with you. It's been a pleasure to watch the development of the great work that you and your colleagues at Xuron are
Thank
certainly
you.
doing. So this is an exciting time for certainly education design and education assessment, and those are absolutely linked concepts. So we need to plan with the end in mind. And so it's such an exciting time to be thinking about how can new technology advances help us both design for the healthcare professionals of tomorrow, as well as make that education that these healthcare professionals need exciting, engaging, and most importantly, practical and relevant, and yield robust application skills, right? So skills that can be applied and performance behaviors that are actually changed through education. So what we know from just looking at the space historically is that it has been challenging, particularly if we think about just again beginning models of paper and pencil, testing, to actually measure long-term retention of skills and long-term impact of education and application of educational objectives into practice. And what we know is that we've had, because of the limits of the technology that we've had to test lots of healthcare professionals as they go through education, we've been testing primarily knowledge-based skills, knowledge-based testing, and then skills-based assessments through largely self-assessment, right? So even competency-based assessments have been a bit challenging. We've advanced, and over the last number of years, certainly focused on case-based application and using that through what we know from gold standard of assessment, that true case-based education can show us and be a predictor of what healthcare professionals will do in practice. Yet those skills, some people call them soft, I call them critical, of patient-centered skills like empathy, communication, and other skills are so critical, and yet they don't translate very well to an assessment that has a set of set closed responses, or even open-ended questions are just so hard to do at scale. So how do we assess for those critical skills that we know healthcare professionals need to practice medicine today and to do that adequately? We know that also learner reactions, learner reflections, those qualitative and descriptive data tell us so much about how education is moving healthcare professionals forward and along the path of skill development to application and practice. And we know that there are aspects of learning, like motivation and confidence, that matter so intrinsically to making that education sticky and making it effective in the real world. So how do we do that in today? Well, we are closer than ever to be able to do that at scale. So tapping into the new technologies that exist, such as AI-generated assessment, AI-generated design, and then assessment tools, allow us to be able to measure the impact of education through the way that education is designed as well, to actually get those sticky behavior, critical skills focused application of education into practice and measure it effectively, again, at scale. We know that resources are always tight. So now is a very exciting time to be in this space, because that we can use technology, and it's getting more exciting every day, can use technology to measure impact of education at scale and to be able to do that with reliability and in a valid way to be able to give us more confidence too that the education that we're designing is actually having that real world application.
Yeah, completely agree with you. And as you laid out, we have come a pretty long way in healthcare education. And we've done a lot of things well, but there's always kind of room for improvement. So, one thing I'm curious about to get your thoughts on. So, how do we make sure that we're capturing not just the clinical skills, but also those crucial patient-centered abilities that you mentioned, and those abilities that truly make a great clinician? The things that historically have been quite difficult to measure.
Absolutely. So we started to touch on those points in the last question, but here we're really referring to those behavioral changes that we need to see, or those behaviors that we need to see healthcare professionals be able to do well and be able to do consistently for patient-centered care. So those can be, again, things like effectively being able to have shared decision-making discussions, effectively being able to have this patient-provider therapeutic connection that includes behaviors and ways of engaging that build trust, that build confidence, that build a shared bond between the patient and the provider. And those are skills that are so critical, particularly now. And when I say particularly now, I'm also referring to the constraints that we have on time. Patients and providers see each other for such a short period of time in that clinical engagement, and being able to maximize the effectiveness of that time through having patients and providers meet in a trusting relationship with effective communication is so critical. How do we do that? By increasing the ability of HCPs to be able to have those skills, then also measure it and show that they have those skills. Or importantly, where they have gaps in those skills, being able to give them feedback so they can continue to improve or hone those skills. And that's where I see some of the technology, particularly the work that you're doing, become so exciting, because we know that relationships between providers are critical. And in that relationship is these constructs of confidence and motivation and outcomes. So when a healthcare professional is engaging in education, we want them to see what good education, what good behaviors, what good patient-centered skills look like, but then be able to do it. So how do we do that at scale? They need to be able to practice. They need to be able to practice and get feedback. And that feedback, that worked example, which is discussed in literature, and has been demonstrated to be so effective in moving educational outcomes forward, it requires real world cases that healthcare professionals can try their hand at being able to carry out those skills, conduct those kinds of conversations, get feedback so they gain confidence in being able to do that in the real world. Where they have confidence, clinicians are more likely to actually do those things in the real world. And then two, we know that motivation is such a critical driver of being able to apply skills in a consistent way. So when we have healthcare professionals go through an educational activity that gives them both the confidence that they have the critical skills as well as the clinical decision-making capacity that they've been able to gain through education, and the motivation to do that because they see the importance of it. They see the way that patients are going to benefit from them doing this well, then they're more likely to implement evidence-based critical skills into that real-world encounter.
Super. That totally makes sense. And why don't we just zoom in a little bit into the measurement of these complex skills? So it's pretty fascinating, at least to me, that how AI has been transforming the space. And you've seen both the traditional assessment methods as well as the newer AI approaches. So can you walk us through how AI is changing the games in ways that weren't possible before? And how do you see these different approaches complementing each other?
Well, certainly I continue to learn from you and your colleagues. And so this is an exciting time. Let me tell you from my perspective what I've seen. I go way back to some of my earliest years of training. Standardized patients was the gold standard. And I remember working in projects where we trained and used standardized patients. Great model, hard to scale and hard to do effectively in an environment today where cost of education is not necessarily growing. I'm sorry, costs are growing, but not necessarily budgets. And we know that we need to have healthcare professionals be able to get consistent and reliable feedback. So where have we seen technology have its greatest impact, and where will we continue to see it have such a strong impact? It is in the ability to scale and make accessible high quality evidence-based education for healthcare professionals to be able to gain those critical skills. Now, while we've been talking about those critical communication skills, let's remember how critical it is that healthcare professionals also understand evidence and how to apply that evidence in an encounter or in their own decision making. So education that can marry that great knowledge base of the evidence with the skills to be able to conduct patient-centered care, that's where we want education to be. And so being able to do that at scale, that's just creating this sort of Z plane of improvement, right? That we want to see in our education moving forward. And that's where AI-driven solutions have such right potential. And we know some folks are already doing that, like your team. So the ability to be able to create consistent, repeatable scenarios, to be able to have interactions that have some script, but are also responsive to the way the learners are engaging, but still be able to assess the impact of the education in a standardized way. So again, being nimble enough to respond to the way the learners are engaging in the education, yet offer standard feedback that allows learners and all the folks who care about the individual learners, institutions, their teams, the folks who might be paying for that education, to be able to see the impact of that across even a large number of folks who may be going through the application. So a couple of other points that I'm seeing is so exciting from a scale perspective and a reliability perspective. The capability to handle unlimited kinds of iterations and practice attempts. Standardized patients, how many times can a learner go through a standardized patient encounter? Cost-wise, probably once. So what if through technology, a learner could go through an experience, get that feedback, do it again, get feedback, further hone their skills, do it again. So they're continuing to gain both skills and confidence and motivation. Well, that's tremendous. And that's what this AI capability and truly the advancements in the space offer us. I think a couple of other points I'd like to mention here is that we know that humans are inherently complex. And so being able to measure certain types of core goals for behavior or impact becomes even more complex because of the innumerable ways that humans can engage with education, including case-based work. So pattern recognition is so critical. And we know that's a critical part of even clinical decision-making. So being able to have an educational program or an educational platform where scenarios can be standardized, yet HCP learners can engage in the ways that they engage with that and through that case-based scenario, and yet feedback is able to be automatically generated, yet recognizing these critical patterns that indicate success, it's huge. And so we know that this is the capacity for being able to offer that kind of deep assessment in a scalable way for the critical skills that HCPs need is only growing. We know that there's future potential for body and other body language and haptics and other types of assessment tools that are so exciting. So when we think about where we're headed and based on where we've been, the ability to have platforms that take what we do every day as educators and scale that, to be able to do that with greater reproducibility, with greater reliability, with in a standardized way, the sky's the limit. It's a very exciting time.
Oh, absolutely. All of this technology and these advancements are super exciting, but it's always easy to get caught up in the hype. But I know that your career's work has been focusing on measuring actual real impact. So how do you think about potentially creating a framework that not only shows individual growth, but helps institutions at large learn from each other and benchmark their progress?
Absolutely. So when I have looked at outcomes from a single program or multiple programs, where it gets very complex is not just looking at the numbers, but making the numbers meaningful. So that's why we very often end up talking about the number of learners who went through a program, because that's easy. You can count the things, or you can count the people who went through a program. Where it gets much more complex is looking at, so what? So they went through the program, so what came of it? So the ability to look at data at scale and the real world impact of education at scale, and then be able to say, oh, this program was focused on these skills and this knowledge base. And this program was also focused on this knowledge topic or this knowledge base in this topic, but also these skills. And then being able to look across these programs and saying, look, we moved knowledge and understanding of learners across through to a certain point. That's great. And we gave them skills. We equipped them with skills also that can be applied in all the clinical scenarios that these physicians or these nurses and these NPs and PAs and pharmacists are going to be engaging in the future. So being able to look at skills even across topics, across large numbers of learners, is a true advancement. At the end of the year, I remember when I was in the supporter chair, looking across all of these programs and all of these data and trying to make this one cogent story of impact, it was near impossible. And so being able to look at aggregated data in a standardized way, particularly where we can look at benchmarks, where we can look at cross interprofessional cohorts and cross organizational cohorts and even cross topics, and see that there has been improvement, that there's a standardized way to measure that improvement, and then be able to, and this is the holy grail, be able to look at cost of learning based on those data, because we can aggregate and we can compare across cohorts. It's very exciting. So with an AI advancement platform that has these AI tools that allows us to measure hard things in a more systematic way and yield impact that allows comparison, we are truly meeting the aims of what so many folks have been trying to do with aggregated analysis across time. It's a very exciting time.
Absolutely. And you just laid out so many different values to using these advanced technologies. But practically speaking, if you were approaching an institution and you're trying to demonstrate value of a product, whether it's to administrators that are watching the bottom line, the educators focusing on the outcomes, or actual learners who are looking to build their own skill set, how do you address these different perspectives?
Oh, those would be three different people who probably came to me asking those questions. So let's just talk about how we can see the use of AI tools as a mechanism to move individual goals. So if I am if I'm working, for example, and I have many times working with a healthcare clinic or a healthcare institution, and we have an aim or they have an aim, and I'm trying to help them in some way, move to meet a certain goal. We want to help improve application of evidence in practice in a consistent way. Well, being able to have a tool that enables learners to be able to translate the knowledge and the skill to be able to apply that in practice and measure that over time, measure individual learners over time, and be able to do that in a cost-effective way, I'm going to be very excited about that. If I'm an educator, so I'm someone who, or I'm working with someone who has put, or a team who's putting a program together, well, then thinking about any efficiencies for design and measurement are certainly very exciting. So thinking about the reduced administrative burden, thinking about enhanced ability to even track learner progress. This is critical. More time on those critical skills and being able to measure the impact of that time and learners' engagement in that. And then I think this is where, as an educator, it's very exciting. Then I can see the impact of the education and how we can make it better. We can see where we took learners and then see the gap that still remains to be closed and then that's feedback, great feedback for us to be able to close that through the next educational activity or even improvement in live time in the activity that we're implementing there. And then from a learner perspective, healthcare professionals are highly motivated individuals. They self-select into healthcare. So they want to do great work. So being able to get feedback and being able to get the opportunity to practice once I have feedback is of tremendous value. So in each of these scenarios, I'm describing the impact and the value, the true promise and potential of an AI-based platform or tool set, or AI generally that's applied in education to be able to help move learners, groups of learners, and then our data on the impact of education on those groups of learners forward. So great opportunity there. You asked me, what are some of the ways that this would have value? I'm going to speak to some of the things that I think just matter. There's a cost benefit. Very often cost efficiency is in the minds of planners, institutions, certainly payers of any program, supporters of programs. But as a learner, I also want to be efficient with my time. So cost efficiency is important, but also just time efficiency and being able to do things or being able to engage in learning in a way that actually yields benefit directly to the learners. So there's both short-term and I think long-term ROI implications for all the technology that we're talking about today.
Fantastic. Thank you so much, Carolyn, for sharing all your insights. So maybe to cap this off, perhaps you can share some very practical advice for those individuals at any type of institution that is ready to take the leap in trying out or implementing a new technology for healthcare education. How would you, but they're having a difficult time kind of getting over their hump. So what would you recommend to them?
So over the last year, I was working with some collaborators on just some research, some grassroots research and across the Alliance community on what we're seeing as some of the core opportunities for the future of continuing professional development. And some of the feedback, it's been published recently, that we received around AI specifically and the use of technology is that there is a place. Folks are a little nervous about it and folks don't know how to integrate. And there's also, while there's excitement, there's some anxiety and hesitancy. So here's what I might just say, bottom line. One does not have to throw the baby out with the bathwater. So how could one take all this great potential that we've been discussing, but that might even feel very esoteric or unclear, like what are we really talking about here? How would one try that out? So if educational planners specifically, we know that there's so many tactics that learners love to engage in. Live learning, some digital format types are super engaging. Consider an AI-driven tool or assessment plan or both, that you would add into as a complement that overall educational design. There's a place for multiple types of learning methodologies. There's a place for different types of educational experiences. Using AI tools, using different technologies gives us an opportunity to integrate new and exciting and truly valuable innovations into existing educational frameworks and methods, and to be able to see how it goes. And so I think that's a way that we can move our industry along, move the learning experience along for learners, and be able to do it with the kinds of feedback that we need on effectiveness, but also just our ability to plan education using these new technologies. They're not scary, but we need to do it very purposefully. So I would say dip your toe in the water, and see how it works for you. And we anticipate that as more people do that, this field's going to get even more great feedback and great data to show the value of these AI tools.
Thank you so much, Carolyn, and we'll talk soon.